Good morning. Myself, Dr. Manisha, Assistant Professor, Faculty of Physiotherapy Department in RPIIT Technical and Medical Campus, Karnal. Welcome to our YouTube channel, RPIIT Academics. If you like the content of this channel, please like, share, and subscribe. Today's discuss about the ischemic heart disease. Ischemic heart disease, also known as CAD, it means coronary artery disease, and also it is called IHD, it means ischemic heart disease, is a condition in which there is an inadequate supply of blood and oxygen to a portion of the myocardium, imbalance between myocardial oxygen supply and demand, caused mainly by atherosclerosis of the coronary artery. It includes angina, stable and unstable myocardial infarction, heart failure, and arrhythmia. Atherosclerosis. Atherosclerosis, it means, can affect any artery in the body. Heart, angina, MI, and sudden death, brain, stroke, and transient ischemic attack, limbs claudication, and critical limbs ischemia, and also progressive inflammatory disorder of the arterial wall characterized by focal lipid rich deposits of atheroma remain clinically asymptomatic until large enough to impair tissue perfusion. Ulceration and disruption of the lesion result in thrombotic occlusion, distal embolization of the vessel. Clinical manifestation depend upon the site of the lesion and the vulnerability of the organ supply. Early atherosclerosis. Second and third decade of life tend to occur at site of altered arterial shear stresses such as bifurcations start with any abnormal endothelial function. Inflammatory cells, predominantly monocytes, bind to receptors expressed by endothelial cells, migrate into the intima, take up oxidized low density lipoprotein LDL particles, become lipid laden macrophages or foam cells. A foam cell dies, it releases its lipid pool in intimal space with cytokines and growth factor. Arterial wall into the intima, lipid core will be covered by smooth muscle cells and matrix form stable atherosclerotic plaque that will remain asymptomatic until it becomes large enough to obstruct arterial flow. Early atherosclerosis, superficial endothelial injury, endothelial denudications, deep endothelial injury, plaque fissurings, endothelium and thrombus, plaque or fat deposit, form cells, lymphocytes, phagocytes, smooth muscle cells, fibrous cap, smooth muscle, and collagen. Now, this is the nomenclature and main history, sequence in progression, main growth mechanism, earliest clinical correlations. Advanced atherosclerosis. In stabilized atherosclerotic plaque, macrophage mediate inflammation and smooth muscle cells promote repair. Cytokines released by macrophage starts degrading smooth muscles layered over plaque. Now lesion remain vulnerable to mechanical stress. Any breach in the integrity of the plaque will expose its content to blood, trigger platelet aggregation and thrombosis that extend into the atheromatous plaque and the arterial wall, cause partial or complete obstruction at the site of the lesion, distal embolizations resulting in infarctions, ischemia of the affected organ. Now we can see in this picture stable angina pectoris, unstable angina pectoris, and myocardial infarctions. Risk factors, effect of risk factors is multiplicative additive. It is important to distinguish between the relative risk and absolute risk. Absolute risk: age, male, sex, positive family history. Relative risk: smoking, hypertension, diabetes mellitus, hemostatic factor, physical activity, obesity, health, alcohol, other dietary factors, personality, social deprivation.